Welcome to the official dissemination event for the National Family Planning Board's Reproductive Health Survey, RHS 2021.
The NFPB registers its profound appreciation to the people of Jamaica for opening their doors and lives to Statins field investigator and providing responses to our exhaustive questionnaires. The results have been long in coming, so let us not prolong your wait any further.
Now that we have arrived at our TFR below replacement level, what are the policy implications? With 1 in 10 women childless at the close of their reproductive life and childbearing women having fewer children, the result is smaller families and an aging population. Underemployment and migration of middle-aged adults in search of better opportunities further deplete the traditional sources of elder care, the extended family. Society, therefore, neighbors, friends, and the government will in the not-too-distant future be called upon to assume the role of caregiver for non-family members. Some strategies which we should consider include shifting tax funding from primary to tertiary education to improve access to skilled care, skilled health, and social care of elders. Creative housing options, such as things like senior villages, could enable community care of the old elderly by younger elders who are retired but fit. With smaller families in low-income communities, social services are going to need to fill this resource gap, as this community generally has limited savings to meet their survival needs, and we are retiring them to go and live for 20 years or more after they have been thrown out of the active labor force. So, what about moving the retirement age? The retirement age was set on the assumption that you are going to drop dead in the next 5 to 10 years. Nah, happen. While men often reported verbal abuse, women were more frequent victims of physical and sexual violence. Jamaica's intimate partner violence rates exceed global averages and reflect society's reliance on violence to resolve conflicts. I mean, I've even heard a 4-year-old child playing and getting upset and tell his friend that he's playing with him, going to kill him. Because these are the things he hears, in his community. These data, however, confirm the effectiveness of including reproductive health in the school curriculum, despite negative protestations when we were trying to introduce them. We are definitely at that place now where we need to add conflict management and violence prevention to the family life education curriculum, and I think we should start in preschool. Adolescents and women 40 years and older reported the highest rates of unwanted pregnancies. How might we meet the service needs of these high-risk populations who are also more likely to have children that have birth defects, despite their relatively low age-specific fertility rate? The goal remains that all pregnancies should be planned and the children wanted. With Jamaica's TFR below replacement level, especially outside of the Kingston metropolitan area, where many jobs are labor-intensive, as well as among the better educated, in a generation, Jamaica will experience labor shortages. How can couples who want to be parents or wish to have more children be encouraged and assisted to do so? Importation of labor may have to come from far away, as other Caribbean countries are also experiencing low TFRs.